Hey there, and welcome to Teens Uncharted, a podcast where we dive into the wild, wonderful, and sometimes what the heck world of being a teen. I'm Charity Chaffee, a teen therapist who works with teens literally all the time. And let me tell you, no two stories, no two journeys are the same. Here, we're talking to teens, we're talking to parents and the professionals who support them, getting real about the wins, the struggles, and the stuff no one ever tells you about therapy and growing up. Whether you're a parent trying to decode your teen, or you're a provider looking to connect, or a teen wondering, is this just me? You're in the right place. This isn't your typical how to parent or therapy deep dive. We're keeping it fun, we're keeping it real, and we're making sure every voice gets heard. So buckle up because we're about to explore the uncharted. I'm so thrilled to introduce our very first guest, Dr. Emily Gordon. With over 2 decades of experience as a licensed clinical psychologist in Natick, Mass, Dr. Gordon specializes in treating adolescents, young adults, and adults. Her expertise encompasses eating disorders, body image issues, anxiety, depression, and more. Dr. Gordon's therapeutic approach is more insightful and practical, integrating evidence-based treatments such as psychodynamic, cognitive behavioral, dialectical behavioral, and family systems therapies. She's often described as warm, compassionate, supportive, and brings a touch of humor to her practice. So beyond her clinical work, Dr. Gordon is active on social media, sharing valuable insights on adolescent mental health, eating disorders, and of course, parenting teens. So today, she's going to share her experiences working with teens and families, discussing the challenges that they face and offer insights into fostering resilience and well-being. We are honored to have her kick off our podcast series.
All right. So I am Emily Gordon. I am a licensed clinical psychologist. I have a practice in Natick, Massachusetts. So I'm licensed to practice here in Massachusetts. I also have a license to practice virtually in Florida and also Vermont. And there's a long stories behind that, but suffice it to say that's where I'm licensed to practice. I have been working in private practice for almost 25 years, working with teens, young adults, parents, families, and even adults in middle and later adulthood. I got my start working at McLean, which is a psychiatric hospital here in outside of Boston. I worked in adolescent residential treatment programs there, and part of the team that started Claremont Eating Disorder Center. So I've worked in a range of places. I've done a lot of supervision and trainings over the years. I love to do speaking, and that's what I do.
I love it. I love that you kind of came from a background of like residential treatment because I think like that is such an interesting, unique environment that not everyone kind of gets into. What was the transition like for you from like residential to like private practice or like more of your own gig?
Well, that is such a great question. It's probably coming from someone who might know something about residential treatment. So, look, I really loved working in adolescent residential treatment. I think that there is, first of all, just something about working with a team of colleagues and other professionals, right? Not just therapists, but like other therapists, music therapists, art therapists, family therapists. In the eating disorder program, we had dietitians, nurses, so like multidisciplinary. So just I really loved that, like learning from and collaborating with other people, other professionals. I think that there's something about, and this is, I guess, where like my love of teens comes from, because there's something about like the realness and the rawness of being with a group of teens. And of course, right, so like anytime you get a group of teens together, I think there's like an energy and, things that happen, a vibe, which my own teens would kill me for saying that word. They don't like when I use the word vibe because they think I'm too old and I can't use it. But also, I think that there's something, when someone is at a residential level of care, whether it's a teenager or an adult, there is an intensity to the things that they are experiencing. And I think that, residential is a really scary, like it's really scary to be in the place where you or your loved one or someone in your family is sort of facing the possibility of residential treatment. But there is also something so powerful and sort of deep about being there and being able to do that work and sort of connect with people and really form like real connection. And that really leads to pretty profound growth. So those are the things that I really loved about residential treatment. I think it was, well, actually, I did my internship in school. Like my last year of grad school was also in a residential day treatment program. So I guess I knew a little. It wasn't by accident that I ended up there. And then the transition to private practice, I think like what we've learned in life, right, is like the pros of something are always the challenges of it. So the intensity of it was just a lot and sort of getting in a way with other things that were important in my life. And so I felt like it was time to do something a little bit different, and more manageable for my own schedule and my own well-being. So it was hard. I mean, I still miss that. I was able to hang on and stay at McLean and do some supervision. And actually, I got to go and do a group in one of their programs even after I left.
I
So I
love
was able to
that.
hang on and sort of keep pieces of it. But it's definitely different to be in private practice and to be on your own and not have that, both in, sort of deeper connection with the people you're working with and also the camaraderie of the colleagues.
Yeah, yeah.
Yeah.
It's interesting because I also spent time in like residential CVAT
Yeah.
that's in Mass. And
Yeah.
one of the things that I will always remember, which is such a valuable lesson for therapists, is when you're in that space, you are seeing and witnessing such profound pain.
Yes.
Like to take that step into
Yes.
vulnerability and being open and having
Yeah.
like all of these people like supervising you and observing you and logging your steps and all that stuff, like it takes, I think, a willingness potentially to kind of engage in that to get out of it what it's,
Absolutely.
for.
Absolutely. And like I said, I mean, I think that's really scary.
Terrifying.
Right. And most of the time, what I think you probably witnessed this too is that people would be so scared and tentative on the way in.
Mhm.
And then you would get to the point where it was time for them to move on and they would not want to leave. Right. And just to sort of witness that, I think, clearly that I think it is a testament to the people and the treatment that has happened, the milieu that's being created. But I think it does speak to the power of what can happen there.
Yeah, absolutely. And I
Yeah.
do think that it's so hard to move on from those environments because I'm the same way. Like I miss my like time in residential dearly.
Yeah.
Like that was such a profound time for me and like learning and growth and supervision and clinical skills.
Yeah.
And
Yeah.
one of the things I say all the time to people is that like teens aren't in a vacuum, right? And like we can't treat them like they are.
Yeah.
And residential, I feel like that was a time where you really got to see that at play and how many
Yeah.
different factors are pulling kids. And, how many times did you see a kid who was like, I'm going to mess up my own treatment discharge because I want to stay here to like
Right.
be with this person who has been such a strong support for me. And like they live in a different state or they live 3 hours away. I'm never going to see them again if I leave.
Yeah. Yeah,
Right.
well, you see that a lot. But and also I think what you see, you have the sort of opportunity that to see them in different relationships, in different settings, right? What are they like in individual meetings versus in a group versus with their family? And you really get to know the whole teen as much as you possibly can. And that's a hard transition too, right? When you are then in your own office and you get to
Yes.
see a teenager like 1 hour, and it's not even a full hour a week, right? And there's so much that you just don't know and get to understand and see. And that can be really hard, especially when you're used to the intensity and the speed of the work in those higher levels.
Yeah. So,
Yeah.
question on that. How do you feel like that has kind of informed the way that you engage initially in treatment with like adolescents, teens, and their parents?
Yeah, great question. So I think that so I try to get as much information as I possibly can, right? And that's a challenge because sometimes teenagers don't want you to talk to their parents, or they're kind of worried about what you might learn or say or share. But I really try to talk to as many different providers and and get as much information as I can on the way in.
Hmm.
Um, and I think that I'm always aware when I'm sitting with a teenager, I'm always aware of like and holding what they themselves are thinking and believing and presenting to me, because that is their like truth and self. But I'm also aware that there might be other perspectives and there might be information that is not coming to light. So just I think knowing and holding out the awareness that exists, and that I might be missing something. And so then when I bring that to a teen and say, well, hold on a second, like, let me understand. Let me make sure I'm understanding this correctly. Or, well, how do you think someone else might be seeing this? And so you can start to explore what those other possibilities might be.
Yes. So I feel like sometimes the pushback I get from parents, especially when I have like a newer client, is like, I'll meet with the teen a few times and kind of get a sense of like what's happening. And if it makes sense, I touch base with the parents. But what's really interesting is that oftentimes they'll say, well, you only have their perspective, right? So like how much could you possibly know about what's going on if you only have their perspective, right?
Right.
And that's just such an interesting dynamic in the work with parents, because again, like they don't exist in a vacuum, right? Parents are part of that family system. We have to work with them to some extent. So like, how do you have that conversation around like, look, this is their reality, their perspective, their facts, right? And in collaboration with everybody else, like that's how we kind of grow this like picture.
Yeah. Very carefully and very sensitively, right? And you're absolutely right. That's where I start, which is this is their perspective and their feelings, and that's my job is to understand and sit with and explore their perspective. So I think that, that comes like, then I also try to understand what is that telling me about the parent, right? What is that telling me about this dynamic and what's happening? And I think that comes from, you know, it, every situation is different, but I think generally it comes from a worry and a fear that like maybe I'm not understanding something, or maybe, something about what the parent knows and believes to be true isn't going to be reflected. And where does that come from? It really just comes from a worry and a desire and a concern, right, to help their teenager,
Mhm.
I think.
Yes. Yeah. Um, I think it's such a huge deal to be able to have those conversations with parents and to like offer insight and feedback and validation, right? Like
Yeah.
it gives you a manual of how to raise your kid,
No,
go through the
no,
teen years, and like
no.
every single teen is so different. We do see
Right,
patterns, but they're also different. And I think that oftentimes like those conversations for me, the parent wants to make sure that like I can see their perspective too,
yes,
and that
yes,
I can balance all those things, that I'm not
absolutely.
100% yes pro everything the teen says, because I think we have to have a healthy skepticism, right, of like kind of like what's happening and what we're talking about, and be able to balance those with like, wait a minute, right,
Right.
like what is.
Well, and let's be, I think you're absolutely right that it is important to have empathy and understanding and sort of validation of where the parent is coming from.
Yes.
Um, and look, it's no small task to like entrust your child or your teenager to somebody else,
Yeah.
and to know that your child might be, sharing things or saying things that are private, that are personal, that are hurtful, that are hard. And I don't take that lightly either. Um, and, it's also, I think the last part of it you said, like, it's not unique to teenagers, right?
There, yeah.
I have this, it's maybe a little different with teenagers because of so much of what's happening in the adolescent brain development and sort of some of these things that are heightened. But you have that healthy inquiry with any person that you're sitting with in your office. And I happen to see a lot of teenagers, but I also see a lot of not teenagers. And so it's not just like we're out to question teens. Um, and truth is that sometimes parents and teens do see things differently, and that's okay. And we can hold, like you said, we can hold different perspectives. We can hold both sides.
Yeah. Yeah. Um, So I guess connected to that, I think one thing that I have talked a lot with parents about is the idea that my role in therapy is not to like make the teen just see parents' perspective, right? Like I'm not
Right.
a mouthpiece for the parent per se, right? I'm assuming you've had some of those conversations as well around like your kind of role in that teen's life.
Yeah. I have, so I definitely have that conversation. I think that sometimes what the harder conversation is, I also can't fix things, right? I can't solve these challenges because some of these are really big, painful, hard things that kids and families are dealing with. And we can work on these things. We can understand, we can improve communication and empathy. But sometimes I can't fix things. And I think that's also a hard conversation to have, which is that, it takes time and it takes work, and I don't have all the answers, and nobody really does. And sometimes we don't know where this is going to go in the future.
Yeah. Yeah.
That's an equally hard conversation.
Totally. And I do think, a lot of parents get their teens into therapy because they want them to have like help and support and they
Yeah.
want to see things change. And I think it is really hard for parents to sit with the idea that their child is in pain, right? Like
Yeah.
there are difficult things going on. Like we, of course, like, would remove any obstacle for our kids to just have the best life possible, right?
Of
Like,
course.
that's the parenting thing. And I
Right.
having a parent who also feels like I have to sit and watch this and I feel so helpless, right?
Yes.
Um,
Yes.
how do you feel like you kind of empower parents to be part of that like treatment process, even if it's not about like fixing and, having their kid be perfect?
Well, so as I have, I guess, grown up myself, right? So, I mean, part of it is just to be curious and present. I think that that is really an uh, underemphasized, undervalued, right? Like just to be present, to ask questions, to be non-judgmental, to listen, to care, to see your kid for who they are and what is going on. I think that that is super important. Of course, there's always, we're always giving the message of like, you got to do that when your teenager is available and wants to do that in the ways that your teenager wants and need, you know, so so I think that's one part of the message. I think that another part of the message is this takes time, and Rome wasn't built in a day, and we're going to work on this together. Um, you know, and I'm sure you encounter this. Like it sort of depends on the age of the teenager, right? If it's a younger teen, then it might be more appropriate and useful to have the parent involved somehow in the actual sessions.
Mhm.
And if it's an older teenager, that can get a little tricky. So I'm always encouraging parents to find their own sources of support, whether that's just, taking care of themselves and making time, for movement or rest or meditation or times with friends or whatever it is, or whether that's finding their own therapist. But parents also need to take care of themselves in order to take care of their teenagers and kids.
Absolutely. I mean, you can't pour from an empty cup, right?
No, no, yeah,
And I do think sometimes like with teens, you have to be with anyone, right? But I think when you're parenting a teen, there almost needs to be like an acute awareness of like what's happened in their life and the ability to kind of remember different frames of reference and what they're talking about and being able to kind of put that together. And like that takes effort, right?
that
That's
takes so much effort. I mean, so we're maybe like veering off a little bit here, but so that's like being a parent is a really hard job.
yeah,
It's really hard. And I mean, I guess we knew that before. Guess we knew that before we started. But one of the things I'm sure you can appreciate this as a therapist, like it sort of has come to my awareness that as a therapist, I got a lot of training and education and supervision and practice around understanding my own feelings and how they might be impacted or impact, the therapeutic relationship or what's happening in the room. And I find that as a parent, especially a parent of a teenager, right, that like our own feelings and our own experiences, be that our fears about what what the world is going to be like or what might happen or how our kid might be, or wanting things to be, easy and good for our child, or memories of our own adolescent experience that, like we had a breakup within a relationship, or we had trouble with a group of friends, or, our parents didn't do X, Y, or Z, or they did do X, Y, and Z. So, like, being the parent of a teenager, the experience of that is that our own feelings are really triggered, heightened. And we really have to like work hard to understand and be mindful and regulate ourselves. And it's so hard. And then not only have to do that, but maybe you have more than one child, and maybe your second child is different than your first child. I mean, probably they are, because they are, right? Or maybe you have more than one kid at a time and like those two are different, right? So like you have to do this every day with each kid. It's really hard. It takes a lot of energy and a lot of effort and a lot of resource.
Yeah. Yeah. But the thing too, that I love about that, right? Because parents are humans, right? And they
Yep.
make mistakes and they're growing and
Yep.
all these things that are happening for them, right? Like we're very complex creatures. And at the same time, I try to like help the teen build empathy for that and also
Yep.
understand that like at the end of the day, we're all trying to do our best, right?
Right.
And it gives the parent a really great opportunity to role model how they deal with some of those things in the moment and what choices they want to make going forward and how they're going to like be aware and acknowledging the things that they don't like about what's happening that they want to do,
Right.
right?
Right.
So it's a great opportunity for that. So I don't know if you can talk about that.
I totally, it's an amazing opportunity for that. And I'm so glad you brought that up, right? So part of what you're talking about is sort of like mutual compassion and empathy and understanding. And part of that, I think, is about the relationship that you are working on and building with your teenager. And that sort of harkens back to like attachment and connectedness. And, yeah, of course, there's a lot of pressure on parents. There's a lot of pressure on teens too. I think everyone's just under so much pressure, but there's a lot of pressure to sort of like get it right, right? Or sort of be the perfect parent. And you're right, we are human and nobody is perfect. And so it is absolutely not only about how you model coping, but how you model when you make a mistake, right? Or how you had a conversation, or how you approach with curiosity, like what you did or didn't do might have impacted your teenager. Um,
Mhm.
so I think that is really an important takeaway for parents. It's not like we have our one chance and then it disappears. It's that it's just every day we have chances and opportunities, and that if we can give ourselves a break and remember that it's sort of like, it's a marathon, not a sprint, right? It's the moments matter, but they're collective moments and they're all building something.
Yes. I love to say that our relationships are a status of exposure over time,
Yeah, that's a
and that
nice way to
like
say it.
we all as humans are going to make mistakes. There are times in session that I might say something that I'm like,
Yeah.
goodness, right? And I like need to have the awareness next time to follow up and be like, hey, can we talk about this thing that happened last time or that I said or whatever.
Yes.
Showcase that like it's okay to go back and have those conversations and it's okay to feel awkward about it and it's okay to like practice that
Yeah.
if you're doing it.
Well, it is okay. And also it is so hard, right? But that also gives us some empathy for what our teenagers are going through, because, so like it's everybody, I think, it's not easy to be in this world. And so I think it's really hard to be vulnerable and to have those communications and conversations with our kids. That's part of the job of parenting, is doing the hard things. And also I think it's important to have empathy that like there's probably a lot about our teenagers that we don't know. There's probably, we certainly know a lot of things and see things, but there's a lot that we don't know and can't know. We're not with them, we're not in them. And so, you know, they're also having a really hard time just trying to get used to their new bodies, their new brains, the new, social media landscape, the demands at school, the social, like there's so much that teenagers have to deal with. Um, so that's important also to just have empathy for and recognize.
Totally. And I think that's one thing that I really love about like working with teens is trying
Mhm.
to like support them in that process of like balancing all the things. And I know that there are a lot of people that are like, oh, you have it easy, all you have to do is go to school. And it's like, if we're gonna look at things in a frame of context like that, like that's actually not easy, right?
Yeah.
And there are so many struggles that people have socially with diet and exercise, with activities and academic, like all of those things just pile on.
Yeah. Well, I think that is, that stance is sort of maybe making assumptions, and maybe it comes from a place of like, I'm really having a hard time. I'm really stressed, and when we're stressed and overwhelmed, it is harder to have empathy and curiosity about other people, right? And as parents, when we feel like we're doing a lot and managing a lot, it can seem like a teenager's job is easy. Um, but it's absolutely not. And if we pause, right, we can probably remember back to our own experience as a teenager, and we can probably remember that, while it's different from the stresses that we're experiencing as adults and parents, it wasn't easy.
I think every generation with where we were at the time, right? Went through kind of like a different series of things, right? Like I was a generation where we didn't get a computer until, gosh, I think I was in eighth grade by the
Yeah,
time we like had one in my house, right?
yeah,
And like that was when like AIM Messenger was a huge thing. We still had dial up, right? Like
yeah,
that was a whole different environment than what we have
yeah,
now, and where it's like their phones are on them 24/7. There's 100% access all the time
yeah,
in different scenarios. And like, going back, would I want to be a teenager again? No. But I really learned a lot during that period of time. And I think that has also been a huge part of why I just love working with teens. It's like it's such
yeah,
a process of formulation and like growth and development. And like I love like, having those really fun, sassy conversations where it's like we can both see eye to eye, but it doesn't,
yeah.
none of us need to be right in that
Right.
moment. We can just have really good conversations.
Well, I think that speaks to, there's an idea out there that like being like teenagers are difficult, right? Or that it's a challenging time and, parents dread it. And, other people who maybe don't work with teens sort of think like, oh my goodness, how could you do that? But I think that what if you can step back from that lens and sort of appreciate that you're right, like there is so much happening. There's so much change, right? On a neurobiological level, on a social level, on a developmental level, on a cognitive level. Like there's so much opportunity, and actually, there's so much possibility. And I think, I actually gave a talk yesterday on this topic, and I was, sort of doing a little bit of research in preparation and understanding, going back and just reviewing the teenage brain and sort of what's happening in the brain. And there's a couple of like really, again, like neurobiologically, there is a drive towards innovation. There is a drive towards like deeper feeling. There's a drive towards like experiencing new and novel things. Um, there does come with it some impulsivity. It is tends to be, a little like, obviously there's riskier behaviors that happen, but if we can appreciate what is happening in the teenage brain and body for like creativity and connection and new ideas, like that's so cool for the teenager. It's like cool for the family, and quite honestly, our world needs that. right? These
Yes.
new ideas and these new solutions and different ways of thinking about things and approaching problems. Like it's actually critical. And so I think that's like the excitement, right? That you feel, that I feel when you're sitting with a teenager is you can sort of just like, you can feel the gears working. You can feel the hope and the possibilities. And that's kind of a contagious feeling.
Yes. Yeah. No, I think that sometimes the best feeling is like after a session when you're like, man, like that was such an amazing conversation. Even if we wasn't finished, even if there's like remnants left to be had, like just being able to kind of like see their brain work in that way,
Yeah.
like what is happening here. Like it's amazing to me.
Yeah.
Like,
And what's amazing too is like you don't have to agree, right?
right,
You
right.
don't have to see it the same way. Um, I find those are even more like the most interesting conversations, right? Both in my own house and, in my office, right? When someone will say to me like, "Hey, what about this?" Or did you think about it this way? And, you know, that's probably something I hadn't considered. And
Mhm.
maybe I don't agree. Maybe I won't make that change or, get around to that perspective. But how cool that we can all have individual ideas and beliefs.
Well, and I think the beauty of it, of having some of those conversations in therapy, is that the expectation is not that anyone changes their opinion, right?
Yeah.
The expectation is that you understand where that opinion is coming from and what has been impacting that development of it, and then what you want to do with that going forward.
Well, right. So that is, I think, also one of the things that's like most exciting about working with teenagers. I also with young adults, and I guess,
Yeah.
people all along the spectrum is like there's so much that comes at us all the time from so many different directions, right? Whether that's our family, our parents, whether that's, school, whether that's social media, whether that's the culture, like whatever it is, there's so much that is coming at us. If I had like a gong, right, for every time someone in my office says the word should, there's so many shoulds.
Yeah.
And what's so cool is being able to help somebody, kind of look at the shoulds, but be able to put them somewhere else and kind of look to what's happening inside and figure out what matters to me. What do I think? What do I feel? What do I need? What are my values? What lights me up, right? Like, how do I advocate for myself? How do I understand what's going on in myself so that I can, take better care of myself? Like that's the empowering part about, I think, the therapy work, which, can be hard for the people around the person who maybe don't see things the same way.
Right. Right. I think it can be really complicated to have those discussions. And I think there's a lot of frustration with parents, right? That like, we've talked about this 35 times, like, this is where you need to get on board, right? Like
Yeah.
parents always like, you need to get on board with this. And that's always an interesting conversation in like family work and, talking about it. Like, and I imagine you experience this a lot when we're talking about eating disorder recovery, right?
Yep.
Like the parent or the family's like, you need to get on board, right? Like you
Yeah.
like do this. Like, do you have kind of like insight into that experience with like teens, adolescents, even in the eating disorder setting?
Well, again, yes, I do. Right. I mean, I think that the question that we have to then sit with or understand is like, what is that about? Where is that coming from? Right. And of course, with an eating disorder, it's coming from a fear, a responsibility, a real concern most often, with the child, the teen, the person's health,
Yes.
right? So you need to get on board most likely means like I'm really scared, I'm really worried, I don't know what to do, or I don't know how to help you, or I don't understand this, and and then like kind of the helplessness that comes from that.
Yes.
So I think that what's most important in those situations is to try to understand, well, I mean, actually, sometimes the parent may be reasonable. They're like there may be something reasonable that the parent is asking for the person, the teen, to get on board with. And then we need to figure out, like, why is this teenager not able or willing to get on board? And maybe there's a different way to say it, or to approach it, or maybe there's some steps along the way, because it's not an all or nothing, like you're either on board or you're not on board, right? It's really looking at what is getting in the way, what are the common goals, and how do we get there?
Yes. So, and that kind of like ties into my my one of my questions is just around resistance, right? Because when we think
Yeah,
about conversations like that, right, if they were happening, outside of therapy and not in the, you know, not in our like ability to facilitate, I feel like there's a lot of butting heads around like you need to do this and I'm not going to do this, right? And I
yeah.
we can look at that and say, okay, like there is resistance there. And I love working with resistance, right? It's like one of those things I will go toe to toe with anybody, right? Because I think it's such an interesting thing, right? Of like, if you have all these people saying this, right? Like, what is that about for you? And I think it's a really beautiful process to understand. But when we talk about resistance, it is one of those things that I feel like in therapy, particularly, right? And in certain like you know, in certain specific treatments and certain kind of diagnosis, there's a lot of people that are like, oh, I don't want to work with that. They're too resistant of a population, right?
Yeah.
And I think a lot of people have said that about teens, and I'm just like, what do you mean? That's my favorite part.
Well, I think that gets to when, for a provider or a person who maybe doesn't want to work with resistant teens, right? Well, it's exhausting,
It is.
and sometimes there can be a feeling of helplessness or discomfort in sitting with that. Look, there's risk in the resistance, right? If someone is, and we have to actually talk about what resistance is, because sometimes it is willful resistance, but most often it is fear, it is lack of skill, it is lack of confidence, right? It like so resistance is like one of those bucket words that we have to untangle and really understand what is this resistance about. um is it about feeling unrecognized or unseen, or um disagreement over, like, the request? um but I mean, it's hard. It's hard to sit with that, and it's hard to tolerate the risk of, someone who has an eating disorder or a substance abuse problem, or, depression or whatever it is, and to kind of sit with that, and kind of let go of the ability to do something about it. It's pretty uncomfortable. It's also, I think, this is another aspect of what's really hard about being a parent, is that it is connected to our own experiences of our own parents and in our own lives. And so, that comes from, like, well, when I was younger, my parents did this, or, children are supposed to be seen and not heard, or, whatever the idea is that you internalize from your own upbringing, and then how you then approach your own parenting. I think there's aspects of that too.
Yeah. Yeah, for sure. Um, it's just, and I know it's so challenging, I think, both in the therapeutic lens and in the parenting lens. And I think at the same time, like one thing I love about the therapeutic field is that there's so many different types of therapists that do different
Yeah.
therapy that
Yeah.
have types of connections. And like
Yep.
I'm very solidly in the camp of like there's room for every therapist
uh,
in this field, right? And
yep.
the groundwork that I do to prep someone for another, like therapeutic kind of rapport in the future
Uh-huh.
is what we can do in that moment, right? And I know that there are folks that have like I would have a really hard time working with certain populations just because it's not the motivation or the curiosity for me,
Yep.
which is part of what drives my work with teens, right? And the fact
Yeah.
that I, like love that resistance. So like I think part of my career and then in the beginning was like figuring out like who do I sit with well, right?
Yeah.
Who do
Yeah.
I really find exciting to work with and like what drives me? Because I think for me personally, if the passion isn't there, it's a lot harder for me to like bring the curiosity that you're talking about.
Right. Well, I think that's beautiful, and how cool that you've like figured that out, right? And sort of had like are now moving in this or doing this work that feels so meaningful and important to you. And you know, I think there's probably, as therapists, as clinicians, we come into this with like, well, I should be able to work with everybody, or, you know, and that's just not true. Like we're allowed to have strengths and weaknesses and preferences and passions.
Mm.
Um, and that also like makes us a little bit vulnerable to, when someone comes into your office and it doesn't feel like a good fit, right? Um, that's okay. But sometimes that doesn't feel good either. And, it's taken me a long time to learn like, it doesn't mean I'm not a good therapist. It just means maybe I'm not a good therapist for that person. Or maybe they're just not in a place where they're like looking for or ready for what it is that I do or offer. And that's okay because, as you said, there's so many different kinds of therapy. There's so many different kinds of support and help and wellness. And it's not really about what I think is like the right, like it's about the person finding what is going to most support them and get where they want and need to be.
And like in that moment, right? And in that moment too, when someone's seeking help and support, they're in a really vulnerable space. And I think that that is part of the guidance in therapy that I talk a lot about is like, I want you to meet one or two therapists before you
Yeah.
decide on
Yeah.
who you want to work with. I want you to like understand some of the underpinnings of like what therapy is before.
Well, especially with teenagers, right? Because I think that what is important, if we think about the tasks of adolescence, right, of sort of independence and separation and autonomy and figuring out who they are, you
Mhm.
know, I, I think that part of the reason why I feel so strongly about this work and about supporting parents is that I think what we know is that parenting matters.
Yes.
But that doesn't mean you have to be a perfect parent. And it doesn't mean you're going to do everything right, like we said before. And it doesn't mean you can do it all yourself. But so if you say to your teenager, this is bigger than us, I think you need some help here. You you have to see a therapist, or I want you, or I think it would be a good idea. Some teens will be like, great, sign me up. When can I start? And some teens be like, no way in hell. Like, I'm not going to do that. And with those teens, I think it can be really helpful to say, all right, you know what? You pick the person. Here's a few options. You meet with a couple people. You tell me who you feel the most comfortable with, but you got to see one of them.
Mm-hmm.
And that, at least, that's sort of a way, when we talked before about like working with the resistance or sort of the different perspectives, that's a way that I think everybody can come out feeling like they can be satisfied with that.
Yeah, yeah. It's like really helping them focus on like the locus of control, right? It's
Yeah.
like, they have control over who they see, maybe what they talk about, like how those sessions go, but they're engaging in this process. And like, sometimes I feel like you have a teen who's like, it doesn't matter what you say, nothing is going to change, right? But like, really, what we know is that like through the relationship, that's where we see the most change. So like
Right.
some of the kids that I've worked with are like, they've been through six therapists, they've like eaten them alive per their own words, right? They're like, you're not going to change any of this, and then 3 years later, I'm just like, wow, so you don't hate me that much.
Right. But it took 3 years of sitting and being uncomfortable and sort of struggling and not giving up on that teenager, right? And recognizing that, like we said before, like, the moment is the moment, and then we can step outside and have the longer context in mind. Um, I think that's another thing we have to remember when we're working with teens and we're working with young adults is that, I mean, really all humans, but especially during that time frame, is that you really are a work in progress. There is so much happening and changing, like I said before, on all levels and in all aspects of their self. And so, we also have to be mindful of like, what are our expectations and what can this teenager reasonably do, accomplish, handle, because the expectations and the pressures on teenagers these days. I am a believer. I do not think teens have it easy. I am a believer that there are really a lot of demands and a lot of pressures and a lot of stresses on our kids these days. In, all colors, all genders, all socioeconomic, like just, I think it is stressful. And of course, each person has different stresses, but remembering that and being able to just meet them, like understand where they and see all that is happening inside of them and around them is so important.
But I think that's like a huge part of work with parents is like helping them, see and hear and be like super visible, right? Like
Mm-hmm.
every teenager, right? They just want to be seen. They want to be heard. They want to be like supported. They want to have conversations. They want to kind of be in it. And I think that like, it's hard to parent nowadays too, because there's a lot of complexities with that. And it's hard to be a teenager. And like, how do we kind of help them all come together so that like
Yeah,
they're really doing the best they can in the future of their relationship and the future of that like teen's life.
yeah. Well, that's the most important part, right? I mean, and as you were talking, I was thinking like, right, so that's one of, I think, the misconceptions or the misperceptions about adolescents is that they, don't like their parents, don't want or need parents, right? That they want like space and separation. I think you're 100% right. What we do know is that teens desperately want to be seen and understood by their parents, but except they may make you think, right? Like the
Yes.
way they're behaving. And I think that's where we have to differentiate behavior from like all the other things underneath it. We have to try to understand what is the behavior telling us or what might be underneath the behavior because they may be acting like they don't care about you or they don't want you. Um, but that's not the full story.
Right. Right. Well, and I think that's like the important piece too, like with parents is like having them be as involved as they can be in that like teen's life, right? Like I love it when teens get into relationships. I love it when they like have friends over and they go to
Mm-hmm.
I love it when they're parts of like sports teams and stuff. And not like the activities are great in themselves, but I think that the cool part about that is it gives the parents all these other perspectives and all these other
Yes.
views to see their kid, right?
Yep.
And then you get this full spectrum of like, oh my goodness, my kid is amazing at this and they're so good at this. And I see them with their team. And like, you just get all these like really awesome experiences that like, if you were just kind of like working and like hanging out with your kid at home, you maybe wouldn't get to see.
Yeah, that's a really good point.
So,
But we have to do that like even when it's not something that's interesting to us.
yes.
um you know my example of that is it's kind of an extreme example, but like we have a dog in the house, right? And um I'm not, I'm not a dog person. And yet we have lots of conversations in our house about the dog, lots of pictures being texted back and forth about the dog, right? Or maybe you have to go to a basketball game when you don't really know or understand basketball, or you have to sit at a baseball game, for 3 hours on a Friday night, or, to an art exhibit or a musical concert or whatever it is, right? But sometimes we have to do things that aren't so interesting or understandable or within our own comfort zone or experience.
Yeah. Yeah. I absolutely agree with that. And I think that that has been a big piece of my journey as a therapist is like, I have a certain thing, like I do triathlons. I love CrossFit,
Cool.
like I have chickens, like there's all these parts
Wow.
of life. And I'm like, I will talk about these things forever. I used to do theater, but when I get like a new teen in session or even a kid I've been working with for a while and they bring up this interest, like you better believe that I'm going to research that. I'm going to look
Yeah.
at it. I'm going to figure, I've read so many books
Wow.
so I can like have these conversations because the thing is like that's content, right? Like
Yeah.
if I can sit there and I can talk softball with a kid who's super into softball and I can use different examples of what happened in the playoffs and what happened here and how these two uh oh my God, positions on the team in right? And I can talk about the mental acuity you need and the physical wellness and all the pieces that go into that. Like I'm literally taking the thing that that kid is interested in,
Yes.
using it as a way to like help them understand and connect
Yes.
all these other dots.
Well, that is brilliant, and that is clearly what makes you an excellent clinician for teenagers, right? Look, I mean, that takes a lot of energy and effort and on your
Absolutely.
part, um, and yet, like, that's our currency. We have to do it.
It really is. And it's like,
Yeah.
I mean, I think about even as adults, right? Like we all have our phones on us, we have different relationships with like social media and technology. And if I'm going to sit and I'm going to scroll and I'm going to like do stuff, I might as well look up this book some kid told me about
Yeah.
that I'm like, oh, I'm going
Yeah.
to order it, or
Yeah.
like listen to this podcast someone had mentioned, or, look into this like thing that they were struggling with. So I can be like, hey, did you figure that out last week?
Well, so now you're getting back to something that we talked about earlier, which is the idea of resistance,
Mhm.
right? And sort of one way that we deal with resistance, which again is not just resistance, it's lots of other things,
Yes.
but is joining with somebody and finding a common language and somehow trying to step into their world, their interests, their passions, their way of thinking, their experience, because that's how we can, like, resistance is about like disconnection, right? Or sort of opposition. And what we want to do is to work towards connection. And that's how we do it.
Yeah, no, absolutely. And I think that the conversations that come out of it are just honestly so beautiful. Um,
Fascinating and interesting. And like that's one of the things, I mean, I can tell this about you. Like that's one of the things that I think I love about this work is that like I learn so much, right? I learn about myself, I learn about other people, but I learn about things that are interesting, other ways of being in the world. I just like I'm always learning, and that for me is just rewarding and exciting and so important.
Lifetime students.
Yeah.
Students.
Yeah.
So kind of on that topic, because I know this entire podcast is dedicated to like, teens and understanding teens and treatment and, any.
Yep.
And I know last week was Eating Disorder Awareness Week. And
Yep.
I also, I work with a lot of high risk behaviors, right? And I think that that is kind of like underneath that umbrella. And so I'm curious if you want to share any of your kind of like insights, anything that you kind of would want to talk about in regards to eating disorders, because it is more of a niche topic. And there are
Yeah.
a lot of people that I think are really good at working with it. And there are some people that
Yep.
I think would love kind of like additional resources and supports, and like, where do we go to get it?
Sure. Well, that is excellent. Those are excellent questions, and I could probably talk for a whole other hour about eating disorders and teenagers and sort of what it's like and how to work with it. Um, so, I think where I would guess I would start is that I think eating disorders are misunderstood, maybe I will say, right? I mean, I think eating disorders are really serious biopsychosocial disorders that are really complex and multi-determined. And so I say that because I think there's sort of this misperception out there like, well, everyone has disordered eating or nobody's happy with their body. And, while I do think we have a cultural epidemic, and I could, espouse for hours on, diet culture and unreasonable expectations and so many shoulds, in
Where
terms
the
of what we
shits are
should
again.
look like and should be eating or should not be like so many. I mean, um, but I think that when someone has a serious eating disorder, it is really very serious and requires treatment.
Yeah.
So that's the first thing I will say. The second thing I will say is that eating disorders really do like affect anybody and everybody, and nobody is immune. And we're still really understanding what are the underlying mechanisms that sort of make someone more vulnerable or make someone develop an eating disorder.
Yes.
Um, a lot of times it starts from somebody trying to be healthy or trying to get fit or trying to kind of make themselves feel better in a way that they think is going to make them feel better. And what happens is that it just sort of takes over. Like there's like a circuit that gets switched and it just becomes consuming and preoccupying and is unhealthy. So I guess those are some things that I can say about working with eating disorders. Of course, all of the topics that we already talked about sitting with risk and discomfort. And, the hard thing about eating disorders is that this may seem counterintuitive, but, people experience them, at least in the beginning, they experience the behaviors as like helping or working in a certain way. And I think that there is an extreme ambivalence about giving it up because there's a lot of fear about what that will mean and how they will feel and what they will look like or not look like. So it's really complicated. It's really hard to engage on, and yet it's so important because eating disorders are also one of the most deadly disorders out there. So there are good resources. There is good treatment out there. I would say, start with a pediatrician or an adolescent medicine doc, or start with a dietitian who has experience in eating disorders. In Massachusetts, we have MEDA, MEDA. They have really amazing resources. There's National Alliance for Eating Disorders. There's National Eating Disorder Association. There really are a lot of good resources, and there's a lot of good treatment, and it works, even though it's hard and sometimes it takes a while.
Yes. Yes. I do think all good things kind of take time. And I think the treatment evolves, as people are ready for it. And I know that there are people that like their whole job is like working with eating disorders.
Yeah.
Right. And I
Yeah.
think that at the same time, when we were talking about residential work, I know that like when you're working with like higher risk EDs or, even residential components, like it is so, you know, not draining, but I think that there's kind of this like chronic thought of like, I want to help this person, right? I want to commit to
Yeah.
this person. So when you have, someone who's maybe coming into the field and wants to do that work, like, what do you recommend as far as just like being able to balance like the burnout from like, I really enjoy this population. How do I stay in this population forever?
That's a great question. Well, I think it means being mindful of your own boundaries and limits, right? I mean, there are times in over the course of my career where I've had, most of my practice focused on people who are struggling with eating disorders, and there are times when I've had less, and it feels different. So, kind of knowing like you can stay in it forever, but maybe that means you're not seeing only people with eating disorders, or maybe that means you need to have a peer supervision group, or maybe that means you need to have a team of multidisciplinary, dietitian, physician. Like you need to work to build those relationships so that you have other clinicians to share and to refer to. So, I guess every clinician has to figure out for themselves what that means. We also probably have to look at like what brought them into the field, and how are they coping with their own stuff. But it's certainly an important conversation to have.
Yeah, yeah.
Yeah.
And I think too, like I joke that if you told me tomorrow that I had to like, I could never work with teens again, that I would quit and find a different job. Because they're just my people. And I think that it fits really well with like my persona, my vibe,
Yeah, yeah,
everything that kind of
I
goes into
get that.
me.
Yeah,
But I also just want to point out too that like it's okay for therapists to evolve as humans and to find interest in other things that we
absolutely.
really enjoy doing. And I think that's part of like being the student, is like being able to reflect on like, where is my practice going? What am I really honing in on right now that I really enjoy working with? And I know you've kind of made potentially a transition from like working with a lot of ED to kind of like working in some other venues, and you have some ideas of like future business stuff for you.
Yeah.
Um, and I'd love for you to kind of talk about that journey for you of just being able to be like,
Yeah.
love this work and there's also more out there for me.
Yeah. Well, thank you for asking that question. Yeah, look, I mean, I think that's one of we talked before about one of the cool things about this field is that we're always learning. And I think one of the other cool things is that there's so many options, there's so much possibility, and there's so many things that need to be done. So, I have, as you clearly have gathered, right? Like I've been working with teenagers for and not just teenagers, but I've been doing this sort of individual therapy, family therapy kind of work for a really long time now. And I really do love it. And I really do, I'm sort of honored and I really do take that job seriously, right? Of sort of joining with someone and being let into their personal experience and like the most private and sort of deep parts of themselves. Like I wouldn't give that up ever. um and also I feel like I have learned some things um and maybe I have some things to offer. And what I know is that the kids who do the best are kids who have a trusted adult in their life, right? That whether that's parents or whether that's another caregiver or somebody else, that what we do as adults matters. It matters for the outcomes of our kids. It matters for our own well-being, right? There's so much research that's coming out these days on like the loneliness of adults and sort of how hard it is to be a parent. And I think it, like I've said before, and it sounds like a drastic statement, but like it matters for the world and for our society. So I am finding as I'm getting older that I feel this sort of desire, need, drive, want to like do more, to share what I know and what I've learned, and to help educate other people in raising teenagers and like ushering them into the world. And I really I love teenagers, and I love like supporting the parents and the adults who are supporting teenagers. So to that end, I started a book talk series where we had one yesterday where I met with a group of parents of adolescents. There's so many resources for parents of young kids, and I think there's not as much resource. It's a lot harder. There's a lot of like shame and privacy and just barriers that get in the way. And it was so awesome to sit with a group of parents of teenagers and have them share and learn from each other and from me and my co-facilitator. So I want to be doing more speaking, more parenting support. I have a new newsletter that I started on, it's called Growing Together. So it's about thank you. So it's about sort of teenagers growing and parents growing and sort of what we can do together. Because it just feels really important. So that's partly come from my work in my practice. It's partly come from like my own parenting, my own teenagers, and just feeling like it matters and it's important. Um, and I want to be putting that into the world.
I totally, totally. I absolutely agree with you. I think, when we think about like mental health as a nation, when we think about all the things that we're going through, emotional awareness and connection and relationships are all just like so, so important.
Yeah.
And I agree with you. Like I take my job as a teen therapist like so incredibly serious because I'm like, I want to A, be always a safe person, and then B, want to like encourage that next generation of like really great minds, right? And really
Yeah.
arts and really great people to kind of
Yeah.
like step into their role as an adult as part of this society and to like lead with the things that they feel really like in tune with.
Yeah.
Um, and I think it's so important to like let yourself like learn and grow. And I'm so excited to hear more about like the book series and kind of see how those like grow and develop. Cause I do think creating spaces that allow people to just present without shame and guilt of
Yeah.
like decisions that they may have made around parenting stuff is so
Yeah.
important.
Yeah. Yeah. Well, I think that's why you and I have so much to talk about and so much. I think we have a lot in common, and it seems like you are charting your own path for working with teenagers and supporting people who work with teenagers. So look, I mean, I feel like we're saying the same things over and over again. There's so much to learn and there's so much to do, and I think that I think people want it. I think people need it. I think it matters and it's important. And so I'm at this phase where I'm going to stop talking about doing it and I'm going to do it because I've been talking about doing, look, it takes energy and it takes time. And, I didn't have that a few years ago, but I have more of it now. And so I think that, we all need to just take that leap sometimes and do the thing that we've been talking about or thinking about doing.
And it's just awesome that we're basically in the same place with that, right?
Yeah, yeah,
Have these ideas that have just been like so passionate for us, and then we're
yeah,
taking a step into like we're just going to do it, and we're just going to
yeah,
see, how it goes.
yeah,
I think part of that is giving ourselves permission to kind of like find our way,
yeah,
right? Which is a
yeah.
huge part of like what I think we probably both do in therapy is like helping teens like find their way, and it may not be
Right,
our way, and that's okay, but
right, right.
it's a way.
Well, and that my last newsletter was sort of about goals and setting goals and having these things, right? Like it's not gonna happen tomorrow, right?
No.
I'm not gonna launch this newsletter and like all of a sudden have 5,000 followers, right? I'm not gonna launch this book talk and have 100 people sign up. But that, maybe I don't want 100 people to sign up. Maybe like the small conversation that we had, like I'm not really sure, but we got to start somewhere, and we have to have the courage and the bravery to just do it and put it out there, which is a little scary. And there is those questions: is anyone going to sign up, and does anyone want to hear what I have to say? But we got to do it anyway. And I think that also again just gives us empathy for what our kids are going through. Am I going to be successful? Am I going to get into that school? Am I going to make the team? Can I do well in this class? We all have the same internal fears.
Yeah. It's
Yeah.
it's actually as you were talking about that, it really rang true to like the parents that are working on their relationship with a teenager because it is those small investments, that consistency over time that's going to build
Yeah.
that relationship you have with your then adult child, right?
Yes.
And I think that's the same thing with like nurturing businesses and nurturing new
Yeah.
businesses and kind of like
Yeah.
out there. So at the same time we're doing this, we're also supporting parents to do that with their
Yeah.
but I'm like
Yeah.
everything is full
Yes.
circle.
And we're supporting each other, which is cool too. So
Exactly. Well, and
yeah.
that's I think one of the biggest things that kind of held me back for a while is that I was kind of like, oh, but there's probably somebody else that would be better at X, Y, and Z, right? There's, like who am I to say that I'm a teen expert in, any of this stuff? And I think I had read something at some point about another person who was running a business. I can't remember what it was, but she had said, she's like, I just stopped asking for permission.
Yeah.
And I just really was like, I embraced that and was like, I'm just going to stop asking for permission. I'm just going to start doing the thing I want to do and see where it gets me.
Well, I love that. And I also love the idea because this is something I talk about with teenagers too, right? It's not a but or like it's
Yes.
an and, right? So I mean, yeah, there might be someone else out there. I mean, I can name a few people out there that are doing this and have much bigger names, right? And so, that can be true. And also, I can do my thing. So I think that that's another way of framing it, right? Is that um, there's no right way, there's no one way, right? Like we can all there's enough for all of us to do things in our own ways.
Yes, absolutely.
Yeah.
With therapy and life and decision making, just all of it. But and it's
Yeah.
it's a really beautiful journey, and I'm very much looking forward to kind of seeing where I'm at, right? End of 2025. And it's just I feel like this is the same thing I look forward to and with teens to be like, well, I wonder where they're going to be at in
Yeah.
months,
Yeah.
right?
Well, I'm excited to see where you're at too at the end of 2025. So
I'll stay with you in your book series.
yeah.
Kind of
Yeah.
like,
Thank you. Yeah.
and I know that we probably have so many other things that we could talk about too. So I'm very excited. at some point to have you back on so we can kind of dig into some more things.
Well,
And
I am game. I think that's another thing I'm discovering about myself, right? Is that I really do enjoy talking about these things and connecting with people who have, similar interests and passions, and just helping people understand some of these really complicated but really important issues and dynamic.
yeah, it's
And
always another perspective,
yeah,
right? And
so
I love that people can take that how they want to, right? Like every perspective is, a different lens of looking at something. And I really appreciate that in working with teens. And sometimes they bring the craziest perspectives and
yeah,
lens that I just didn't anticipate. And I'm just like, you know what? You're not wrong, right?
yeah,
Like, let's have it out. So,
yeah. Sounds
um,
great.
any upcoming events for like your book series? Because I think that will be like really great for folks. So if you're out there and you're listening, connect with Emily. She's amazing. I cannot wait to have more conversations. So
Well, thank you.
I hope
But yeah, you're pretty amazing yourself. It's been a great conversation, and look forward to more.
check out teensuncharted.com for more resources. And if you're all about growth and raising resilient, vibrant teens, head to raisingvibrance.com to hear more about me and my practice.